Happy New Year. I'm Dr. Sandra Gothard, one of the founding physicians of Village Health Partners, and I just want to take about 5 minutes of your time today to discuss the whys, whos, wheres, and expectations for the COVID vaccines. So let's jump right in. So let's start with the whys. One bullet point for the whys is the obvious. You just don't want to be in the number of deaths related to COVID. COVID has accounted for 350,000 American deaths roughly, and hundreds of thousands more are predicted to die prior to April. So we make up 3% of the world's population, but account for 20% of the world's deaths to COVID-19. So that's definitely a good reason why you would want to get the vaccine. You also don't want to be a long hauler. Long haulers are patients who've done fine as far as survival, but have not done fine with long-term issues related to COVID. Those issues are lung disease, blood clots, and brain fog, which we see quite a bit of in some of our patients who have survived COVID. The third bullet point I like to say, it's our way out. The COVID vaccine is a way not only to save lives, but also our economy. There's people and patients and friends who are in dire straits right now with mortgage and being in food lines in a situation they've been in before. So this vaccine is a way to improve not only our lives and health, and safety, but also our economy. So let's jump right into the who's. We've covered the whys. Now, who should be vaccinated? Currently, our country is in phase 1A and 1B. 1A mostly deals with hospital employees and nursing homes. Phase 1B are going to be most relevant to this video today. Later on, in the months to come, phases 2 and 3 will be in play as dictated by the state. So let's jump right in as far as phase 1B. That's going to be people over 65 or people over 16 with chronic diseases such as cancer, heart disease, lung disease, kidney disease, type 2 diabetes, sickle cell anemia, pregnancy, although pregnancy is a blessing, not a disease, and obesity. Obesity will qualify many patients for a 1B. Obesity is defined as a body mass index over 30. And the way you can figure out the body mass index is knowing your height and weight and calculating that online. So we just talked about the why, the who's, now where. So Village Health Partners has yet to hear back from the state on when and if we will receive our allocation. We also are expecting the state to allocate vaccines in the near future for later on phases. So we will be emailing all our patients soon as we hear anything. Village Health Partners also does not need emails from patients about what phase in a list for phases. We have a robust database and we can easily query our patients over 65 or those over 16 with the medical conditions I mentioned before, and we can reach out to those when and if we get the vaccine. So in the meantime, I have patients in 1B who are already getting vaccinated at local hospitals and pharmacies. It's a small amount of people because the vaccine is not readily available, but the supply is improving day by day. So you can go to the Texas Health Human Service website and put in your zip code, and it will list you the available pharmacies and hospitals in the area that are taking appointments. So I encourage everyone to look at that. If you are not fortunate enough to get an appointment and you still are in a 1B phase, please don't panic. The vaccines will be readily available in the weeks to months to come. So the light is at the end of the tunnel. Don't worry, just take a deep breath. You'll get it soon. Then the final part, after covering the why, the who, and the where, is the expectations. So when I received my vaccine at the pharmacy several days ago, I was sore and fatigued and slightly nauseous. Those were symptoms that resolved pretty quickly within a day, and I feel absolutely great. The other expectation is it takes 1 to 2 weeks after the second dose. The 2 vaccines out require a repeat dose 21 to 28 days later, but it's not till 1 to 2 weeks after the second dose where 95% immunity takes place. You still need to protect yourself because we don't know. Those of us who get the vaccine are transmitting the disease asymptomatically, so you still need to protect yourself until we reach herd immunity in our country. So to conclude, it's a great vaccine. It's been expedited but not rushed. RNA science has been out for decades, and we've already had the blueprint on the vaccines. So to use an analogy, all we need to do is change the hubcap on a car, but the car's been in place for a while. So the roadblocks and red tape is removed. That's what led to a fast approval of the vaccines for an emergency use basis. So great vaccines. It's not new science, been out for a while, very safe. The other thing is the vaccine cannot possibly cause COVID-19. So Happy New Year. Thanks for spending some time with me today, and be wise and immunize.